occupational English test, practice test, listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You hear an obstetrician talking to a woman about her pregnancy. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, it's nice to meet you, Mrs. Jackson.
Hi, you can call me Alison.
OK, very well, Alison. So today will be your first ultrasound, is that correct?
Yes, first ultrasound and first pregnancy. A lot of firsts today.
Ah, yes. So before getting pregnant, Alison, did you often have irregular menstrual cycles?
No, I was always fairly regular when it came to my menstrual cycles.
OK, and how about the pregnancy so far? Any complications?
No, not at all. So far my pregnancy has been fairly uneventful. Very little morning sickness. And just in general feeling a bit tired, but that's all. Everyone keeps telling me how lucky I am, particularly my mother, who says she had a very difficult pregnancy when she was pregnant with me.
Well, that is fairly standard. So since you became pregnant, no vaginal bleeding or anything like that?
No, none at all. No periods or spotting at all.
So, let's see here. All of your vital signs are within normal limits, including blood pressure, and your chest examination is normal as well. According to your file, you are 23 weeks, is that correct?
Yes, that is correct. 23 weeks.
Something is a bit off here. Your fundal height exceeds what is expected for 23 weeks.
What is fundal height?
Fundal height is the distance from the pubic bone to the top of the uterus and is measured in centimetres. Generally, after 20 weeks of pregnancy, the fundal height measurement matches the number of weeks you've been pregnant. Your fundal height corresponds to 25 weeks of gestation, not 23 weeks. Is there any possibility that you miscalculated the date you got pregnant?
No, I'm fairly certain about the date. I don't really want to get into it, but yes, I'm positive that I have the correct date.
Well, when we do the transabdominal ultrasound, we will get a better look at what might be going on, but I do want to tell you that a uterus that is larger than expected for the corresponding gestational age can be a clue that the fetus or something else within the uterus needs a closer look.
What does that mean exactly?
It could mean a number of things. In this case of you measuring larger than expected, it could indicate too much amniotic fluid, which could cause shortness of breath or preterm labour. Another possibility is that your baby is significantly larger than average, or is in a position that is making the measurement larger than what it should be. There are some more serious possibilities as well, but I won't get into them unless necessary.
I could be having a really large baby? My husband was a really large baby.
Yes, that is a possibility. Fundal height measurements are a tool that we use to gauge fetal growth and to know that the baby is growing at a steady rate, but it is not an exact science as there are a number of things that can make it less accurate. That is why we'll do an ultrasound to get a better look.
OK. All of this is quite scary, but I guess everybody feels this way with their first pregnancy.
Yes, that is quite right. So now...
Extract 2, questions 13 to 24. You hear a sports podiatrist meeting with a patient referred by his GP. For questions 13 to 24, complete the note with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, it is Mr. Godfrey, correct?
Yes, that's correct, but you can call me Vance.
OK, Vance. So, you were referred to me today for an ongoing complex heel condition in your right foot.
Yes, that is correct. I was diagnosed with plantar fasciitis 2 years ago.
Yes, I saw the ultrasound report you sent in, which showed you have a mild case of plantar fasciitis. So, where are you feeling the pain exactly?
The pain is under the base of my heel, in the centre. I also have started to feel pain on the side. I have noticed that when I just twist my ankle a bit, the pain starts on the side of my heel.
And how does your day start off in terms of the pain in your foot?
Well, my day starts off pretty painful. I feel a significant amount of pain when I place my heel on the ground. But then the pain under the base of my heel goes away within the first 10 to 15 minutes of the day.
What about the pain around the lateral side of your heel?
That continues throughout the day and does not seem to ease at all.
OK. Any recent injuries?
Yes, I have had 3 ankle sprains in the last 6 weeks. I went to another podiatrist but didn't receive any help. That podiatrist advised me to apply ice packs to the base of my heel and to roll my heel on a hard object like a golf ball, and to take anti-inflammatory medication to reduce the pain. I've tried all of these, but I haven't seen any changes. That's when my GP referred me for an X-ray of my foot, which didn't show anything significant. So that's why I'm here, keen to get a second opinion. It has been quite frustrating dealing with so many doctors and getting nowhere.
Yes, I understand. So the pain that you're describing as being under the base of your heel is consistent with plantar fasciitis, but the other pain that you describe around the lateral side of your heel is probably not related to that, and for that reason concerns me more. Based on what you've told me, I suspect there is some pathology with the tendon of the abductor digiti minimus muscle or the sural nerve. I'm going to order another ultrasound to assess the area in more detail.
OK, I see. And if the ultrasound comes back the same as before?
We will have to wait for the results, but in the meantime I'm going to treat you for plantar fasciitis to see if there is any improvement in both of your conditions. I'm doing this because there is a small chance that the pain you're experiencing laterally is a referred pain from your plantar fasciitis. So I'm going to have you fitted for an immobilisation boot, which will reduce the strain on all parts of the heel and allow for rest and recovery.
OK, I have a question. A friend of mine went to see another podiatrist and received a new treatment. I think he told me it was some injection therapy.
Yes, I can perform that treatment, and it does have some benefits as a diagnostic therapy.
Could that happen today?
Oh yes. It would consist of injecting 3 millimetres of xylocaine into the lateral area of the lower fibula in order to block the sural nerve. You should be able to tell right away if your symptoms have improved, and then you should continue to monitor your pain levels for the next 24 hours.
I would like to go ahead and have the injection, but first...
That is the end of Part A. Now look at Part B.